Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
The majority of what we see are patients complaining of acid reflux or gastroesophageal reflux disease, problems with bowel movements. Those are the two predominant problems, whether the latter be from irritable bowel or some other type of pathological process in the stomach and intestines is not always clear initially, but those are the two most common things. As far as reflux is concerned, the most common symptom of reflux is heartburn. Most of us experience that sometime in our lives, and in most cases it's very short-lived, maybe related to what we've eaten or to what we drank. Other people have more chronic symptoms, and those people are said to have GERD. Everybody who has heartburn does not have GERD, but when it becomes a more chronic process or a process that may damage the esophagus, that's more consistent with the diagnosis of GERD. Well, most people know to come in, certainly if they have symptoms that are not being controlled with outpatient medications, of which there are quite a few nowadays, that's when they will come in. If they're having a complicating issue, having difficulty swallowing, they are vomiting blood, or they're losing weight, those were things that I'm sure would get them to a physician faster. Many people will endure their heartburn for a while because they can buy over-the-counter medications that will help it. But people have more sustained problems, often the ones that seek help. Well, in general, the first thing is a history, and oftentimes that may be all you need. A history in a medication trial, if it's successful, will be all it's necessary, at least initially. On the other hand, people who have more significant problems, who are having swallowing issues where food won't go down well, it's getting stuck on the way down, or people that are vomiting or people that are bleeding, in those cases we will usually proceed with an endoscopy using a lighted camera to pass through the mouth into the esophagus to visualize the esophagus, and at the same time look in the stomach in the first part of the intestine. That's not always necessary. In other people, we might do an old-fashioned X-ray, an upper GI series, because there are issues we want to check out radiologically first or second. Oftentimes, certain foods can precipitate the problems. In fact, many times, caffeine-containing beverages, alcohol definitely, nicotine in smokers, citrus fruits, tomatoes, tomato sauces can all be a problem. You can have a problem if you eat and lay down, or you eat late and go to bed. Those can all be issues that can cause problems. So the first thing is there something that you're doing yourself that you could remedy? And oftentimes there is. The problem is many times we'd rather take a medication than follow a stricter diet to remedy the situation.
For more information, visit us online at conwaymedicalcenter.com.